Hi, Aaron Baudet again, and I am now going to explain to you how Medicare supplements work. There are two main configurations that we see with people who have Medicare. There's two ways to offset the cost that Medicare doesn't cover. In other words, to transfer the risks, there's two main configurations that we see. Number one is somebody has original Medicare, Part A and Part B. They add a Medicare supplement and they add a drug plan. That's one configuration. In the 90s, that's pretty much all we saw until the late 90s when Medicare Part C came out. It's also called Medicare Advantage. Part C and Medicare Advantage are synonymous. So those are the two main structures we see. There are others, but those are the main ones that we see. In this video, I'm going to call it a coaching newsletter. I'm going to explain to you how Medicare supplements work and go through some of them, but more importantly, explain to you how you can understand the different ones that are out there, because in most states, certainly in New York State, which is what I'm talking about right now, these plans are standardized. So one plan that will mirror a plan from another company identically. That's the way they changed things quite a while ago. So if you have, they use alphabetical letters to designate them. If you have a plan N with one company XYZ, or you have plan N with company ABC, the benefits are going to be identical. So that's kind of important to know. What are the main benefits? What's attractive about Medicare supplements? Well, there's no networks. You can go to any doctor that takes Medicare. There are some that don't, but the majority of them, I don't know, perhaps north of 95% of them do take Medicare. So there's no network. You don't need referrals. It makes life pretty easy from that perspective, especially in my area, upstate New York, where a lot of folks will go to New York City to see doctors. That's just, they've migrated north from the city. They want to see doctors in New York on occasion. That's one benefit. The other benefit, you may pick up a plan, one particular Medicare supplement that has very strong hospital, where if you go into the hospital, you have no copays, essentially for a year plus 150 days, and where there are perhaps no copays for doctors or surgery or specialists, testing. They can be very robust from a hospital and medical perspective. There's no medical exam to get into one of these programs. There's no underwriting in New York State. That's kind of cool. Neither does Part C, but it's interesting. In most states, they will medically underwrite you. They're going to ask you health questions. Here in New York State, they will not, to get into one of these programs. Most of the time, there are no waiting periods either in New York State. There are circumstances where there may be a waiting period if you're into Medicare already for more than 6 months and you don't have any coverage at all beyond Medicare, and you go into one of these plans. There can be a variety of waiting periods for pre-existing conditions. That's something we can talk about in more detail if we get the opportunity to talk one-on-one. That's generally what I recommend, is talking with myself or my son Travis to kind of understand what's probably in your best interest to consider. What solutions are going to be in your best interest from an affordability, coverage standpoint. And things change as time goes on. That's why we're here. So we can help you make adjustments as your circumstances change, because they all change for us. So, okay, let me get right into this. Thanks for your time. Okay, maybe you've seen this chart, maybe you haven't, but these are the current active policies, supplemental policies that you can get. Plan A, B, D, G, K, L, M, N, C, and F. There are a couple of others. There's a high deductible Plan G and a high deductible Plan F. C and F you can only get if you are eligible for Medicare before 2020. We're not really going to talk about those, but I'm sure you've heard your friends talk about Plan F, which is a nice plan. But right now, this chart I'm going to go over with you. I'm going to explain to you what may be attractive, what you should consider, and why you should consider it. All right. Hopefully you've watched my How Medicare Works in 2023 video, because I'm going to talk about the components I listed there. The first thing to think about is this: the Medicare Part A deductible. I like plans that have the check mark that cover this in full. I'm not a huge fan of these. Not that they're bad, just I'm not a fan of them myself. Plan N covers it in full, and so does Plan G. These are two plans that I am attracted to, and you may want to consider them. What is the Medicare Part A deductible? It is this $1,600 payment I referenced in the other video that covers day 1 through 60 in the hospital, whether it's 1 day, 7 days, or 60 evenings in the hospital. So Plan N and Plan G will cover this in full. If you come out of the hospital and go back in, it'll pay it again. It'll pay it every time it occurs. As this changes next year, inevitably, as it changes every year I've been in the business, so will Plan N and Plan G. All the other ones will. They will adjust automatically. For days 61 through 90, the $400 a day, the days 91 and after, the 60 lifetime reserve days, and the additional 365 days beyond the lifetime reserve days. What covers that, you ask? That is on this part of the chart, Part A coinsurance and hospital coverage. As you can see, all plans cover this. Again, Plan N and G are attractive to me. If I'm going to buy a supplement, I'm probably going to consider one of those two. The Part B coinsurance, that's the 20% on Medicare Part B that we talked about before for doctors, surgeons, testing, etc., etc. Again, most plans cover it. Some cover only percentages of it, but Plan G covers it in its entirety. Plan N covers it with subject to some copays. What are the copays? Up to $20 per office visit. This doesn't matter if it's your regular or specialist. It's up to $20. This is after you've satisfied the deductible of $226. And there could be a $50 copay for an emergency room visit, which is waived if you are admitted to the hospital. So if you're using blood, again, Plan N and Plan G are covering this. Part A hospice care, coinsurance or payment, Plan G and N are plan covering this. Skilled nursing, this is if you are transferred out of the hospital into skilled nursing. Days 1 through 20 are covered 100% by Medicare Original. However, the $200 a day copay from days 21 to 100 are covered by both Plan N and Plan G. None of the current plans are covering the Part B deductible. That's the $226 annual deductible you must satisfy before Medicare commences payment. Now, what's the difference besides the copay on Plan N and Plan G? It's this excess charge bit here that Plan G does cover. The other plans do not cover it. This is an amount above what Medicare approves. Again, it's pretty rare that I see it, and usually you know ahead of time. We don't like surprises. However, it does occur very rarely. As I said, I've only seen it a couple of times in the last 20 years, and I've seen a fair amount of claims. Plan G does cover this up to the legal limit. That is the main difference beyond the copay of $20 and $50 between Plan N and Plan G. Both Plan N and Plan G give you foreign travel benefits. There's a $250 deductible per calendar year on the foreign travel, and then the plan pays 80% up to a maximum of $50,000. Okay, hopefully I didn't go through that too fast because that was not my intent. My intent was to be efficient with time, with your time. Those are some of the complaints I've had in the past, so I'm trying to just keep it more relaxed and just get to the facts. I'm going to add a few things here. First of all, that you probably should get some help, some assistance from somebody like me or Travis, my son, or somebody like us who understands how these things work, and somebody who's going to stick with you, somebody who's in this full time, not somebody who just jumps into the business for 2 or 3 months a year. There's a lot of those folks because there's one time of the year when it is extremely busy. Now, if you didn't notice, I have not talked about medications because Medicare, original Medicare, does not cover medications, nor do Medicare supplements. Some of the supplements come with gym membership, by the way, these days, which is kind of newish. Not all of them. And the rates on these plans vary by zip code, essentially by county. In New York City, they're going to be more expensive than they are going to be here in the Hudson Valley. They're different near the Canadian border. And they do change, of course, as claims go up and whatnot, prices go up. So you really need to call to get an accurate price based on when you're doing this and what plan you want. Plan N is a good solution. It costs much less than Plan G. Plan G is kind of a soup to nuts thing, except for the $226 deductible. You're not going to have any bills. If it's a Medicare approved service, there's not much left to bill. So next video, I'm going to get into things like Medicare Part C, co-pays, and we're going to talk about medications. On the supplements, as I said in the beginning, there's no networks. You're not going to have to worry about whether your doctor takes it or not. Unless you've been to your doctor and he insists you pay up front because he doesn't bill insurance. That's incredibly rare. So again, appreciate your time. Stand by for the next video.